We are live, but we will give 1 or 2 minutes so that people can join in and then we can start.
Sounds good.
Are you guys okay to start?
Yeah, I'm okay.
Okay. Good evening, everyone. This is Salma Zahid, your Member of Parliament for Scarborough Centre, and I am here with our town hall. Today, we will be talking about women issues. We will talk about the economic uncertainty for women during this pandemic, domestic violence, and child care. Um, I am joined today with three special guests. It is Soha Muhammad. She is the former project facilitator with the Working Women's Community Center on Decent Work for Racialized Women. And she will talk about her work and speak to the economic uncertainty of women during this pandemic. Welcome, Soha. We also have Zainab Habib. She is the house manager at Nisa Homes, and she will talk today about her work and speak to the domestic violence during this pandemic. Thanks, Zainab, for joining us today. And we also have Rasha Mahyar. She is the settlement manager at Arab Community Center of Toronto, and she will talk about her work and speak to childcare responsibilities during the pandemic. So I will give you all a brief overview of some of the new announcements which Government of Canada has done to make sure that help is there for all Canadians as we all navigate through this pandemic, and then invite each one of them to give the update on what work they have done during this pandemic. And after that, we will go into questions and answers. And we would love to have questions from you and have each one of us answer that. So if you have any questions, please type in the chat box and we will take those questions. So the Government of Canada has recently announced the Safe Restart Agreement worth $19 billion, which will follow negotiations with the provinces and territories and will help get Canadians back to work safely and prepare for potential second wave. This Safe Restart Agreement is for the next 6 months, and it will include investments in priority areas, including increasing testing and contact tracing, which is really very important to stop the spread of this disease, securing personal protective equipment for frontline healthcare workers and businesses, supporting the most vulnerable, including seniors in long term care facilities and nursing homes, ensuring safe childcare is available so parents can return to work, supporting people who do not have paid sick leave, helping municipalities deliver key services, including transit and other services for which the Canadians rely on. And today, Minister McKenna, the Minister for Environment, has announced under a Safe Restart Agreement $1.8 billion investment in transit funding, of which $1 billion will be coming to the province of Ontario. We have also worked on expanding the Canada Emergency Wage Subsidy, which is helping businesses keep their employees. So on July 17th, our Finance Minister, Bill Monroe, proposed changes to Canada Emergency Wage Subsidy Program. An extension of the subsidy would be there until December 19, 2020, and few changes are being made to the wage subsidy program. We are making the subsidy accessible to a broader range of employers by including employers with a revenue decline of less than 30% of the ability to apply. We have also introduced a top-up subsidy for up to 25% for employers who have been worst hit by this pandemic. And on July 20th, 2020, Minister for Families, Children and Social Development, Minister Ahmed Hussain, announced that Canada Child Benefit will be increased again for 2020-21 benefit year. Families with children under the age of 6 can receive a maximum benefit of $6,765, and for children between 6 and 17 years old, a maximum benefit of $5,708. This is on top of the one-time additional $300 payment per child that the parents received with their May payments. So that one-time payment of $300 per child was given to the parents during the month of May to cover the cost during this pandemic. The government is also making it easier for disabled people to get the financial relief during this time. A non-taxable one-time payment of up to $600 will reach about 1.7 million Canadians with disabilities. So this one-time disability payment, which was only going to benefit Canadians who qualify for the federal disability tax credit, will now also be given to those Canadians who are receiving disability benefits through the Canada Pension Plan and also the Veteran Affairs Canada. So the legislation has passed, and all those Canadians with the disability tax credit or getting disability through CPP will be getting a one-time non-taxable payment of $600. So that was some update on general, but now coming to our topic of support for women organizations and shelters and what we have done for women. I also have the honor of being a member of the standing committee in the House of Commons on the status of women. So since last mandate, I have been a member of the Standing Committee on the Status of Women. In the last mandate, I was the vice chair. Now, once I became the chair of the Standing Committee of Citizenship and Immigration, I'm not a vice chair, but I'm a member. And during this pandemic, in the first week of July, I had the opportunity of going to Ottawa to hear to the testimonies of the organizations as part of our work for the Status of Women Committee. And the analysts are in the process of compiling a letter with our recommendations based on the testimonies which we have received from the witnesses. So it is very clear that women have been hit very hard during this pandemic. And the statistics show that domestic violence has increased. More women who have young kids have lost work because the lack of the ability for them to go out and work, as the kids are not going to school, being home. So our government, I'm very proud to be part of the government which has taken measures right from the beginning to make sure that support is there for the women organizations and for the women entrepreneurs. So many initiatives have been announced, but a lot of more work has to be done. I will give you a brief overview of what support we have already announced during this pandemic. So back in April 2020, the Government of Canada announced up to $40 million through Women and Gender Equality Canada for all women fleeing gender-based violence. So up to 26 million has was for the Women Shelters Canada to distribute it to approximately 575 organizations working for women shelters and violence against women across the country. Up to 4 million to the Canadian Women's Foundation to distribute to the funding to sexual assault centers across the country. 10 million of that funding was to be provided to Indigenous Services Canada for the existing network of 46 emergency shelters on reserve and in Yukon to support Indigenous women and children fleeing violence. This funding is in the process of being dispersed to over 500 women shelters and also sexual assault centers. So the first phase of emergency COVID-19 measures has enabled over 420 shelters and 89 sexual assault organizations to stay open and operate with new COVID-safe measures in place. Just recently, on July 20th, Minister Mariam Monsef has also announced that 10 million will flow through an agreement with the Canadian Women Foundation to support organizations beyond shelters and sexual assault organizations that are providing support to those facing gender-based violence. So this funding can be used to support the COVID-related needs, including purchasing protective equipment, converting workspaces to allow for social distancing, purchasing of electronics to support working from home, providing emergency shelter in hotels for survivors of domestic violence, and other measures to address the increased need for gender-based violence for services. So some 200 organizations across Canada have already received their funding, including Agincourt Community Services Association and the Scarborough Centre for Healthy Communities, which have locations in Scarborough Centre and doing an amazing work. Overall, the government is investing more than $50 million to support women's shelters, sexual assault centers, and to ensure that these organizations can continue helping the vulnerable women and girls. We have provided a lot of support for the women entrepreneurs also. And the government recognizes that this pandemic has severely affected sectors such as retail, hospitality, and food services sectors where women entrepreneurs are most present. So on top of typically operating smaller businesses and having less access to capital, many women also still bear a great share of domestic work, caregiving, as well as childcare. So back in May of this year, Mary Ng, Minister for Small Businesses, Export Promotion and International Trade, announced that Government of Canada will provide 15 million in additional funding to support women entrepreneurs through the Women Entrepreneur Strategy. So this will go directly to select organizations that currently are women entrepreneur ecosystem fund recipients and will help women entrepreneurs through this pandemic. So in addition to that, I know homelessness has also been a big issue. So in COVID-19, being homeless presents greater risk to one's health because of their inability to adhering to public health guidelines. So which includes self-isolation and lack of healthcare options if one develops the symptoms. So government is already investing 157.5 million to address the needs of the Canadians experiencing homelessness through the Reaching Home program, of which portion of the funding will also go to women shelters and organizations, as they are some of the most vulnerable at this time. Childcare. As the economy is reopening in several stages, more and more parents are being called to work. So which means that childcare becomes a concern as daycares and childcare spaces are limited. So the government is working with all the provinces and territories to extend the current bilateral ELCC agreements to provide at the earliest opportunity 400 million for 2020. So the childcare funding is included in the Prime Minister's 14 billion pledge to the provinces to assist with post-COVID recovery efforts. The government is moving forward to create up to 250,000 more before and after school spaces for kids under 10, and we are taking action to cut fee for before and after school programs by 10%. So these are some of the programs and the funding which we have recently announced to make sure that help is there for all women who need who have been hit hard during this pandemic. So with this, I will end, and we will invite our special guests who have been doing an amazing work and have been working very hard to make sure that the services are there for all women, whether it is shelters or whether it is getting ready for the day, providing daycare facilities. And I will first of all welcome our guest, Soha Muhammad, uh, who is the former project facilitator with the Working Women's Community Center on decent work for racialized women. And she will speak to the economic uncertainties of women during this pandemic. So over to Soha. Welcome, Soha. And
Thank you.
the floor is yours.
Thank you so much, Salma, and thank you for those updates. And I'm so happy to be here with all you wonderful women. I'm so happy to be here. This is such an important conversation, and I'm happy to continue this work. So as Salma said, my name is Soha Mohammed, and I work at the Victoria Park Hub. I was the project facilitator for the Decent Work for Racialized Women project, which was a 3-year federally funded project from Status of Women Canada. It just wrapped up in March. So Decent Work focused on promoting decent work for racialized women and how we can advance their economic justice. So just to give you some background, the project was a result of research conducted by our project lead, Access Alliance, as well as evidence from several other research and studies which indicated that precarious work is highly racialized and gendered. Women, racialized groups, immigrants are disproportionately overrepresented in low wage and precarious work. And then when you factor in intersectionality, racialized women who are immigrants face the worst levels of precarious employment. So us, along with a few other incredible organizations with the same funder, work to tackle this issue through various avenues. I work on the community level. And I've worked to coordinate community mobilization, leadership development, and capacity building components of the Decent Work project on behalf of Working Women Community Center as project partners. And one of the key components of this project was to directly invest in the leadership of racialized women in communities who were experiencing barriers, and women leaders specifically. So we tapped into grassroots networks, we joined forces with them, we worked collaboratively together. They participated. We had a group of 10 women who were community action leaders, and they participated in the project as consultants and trainings because we used their experiences and their expertise. And these were all racialized women who were also precariously employed, 9 out of 10 of them living in Scarborough. And in the 3 years, our community action leaders partnered with other grassroots organizations, outreached, planned and facilitated workshops on workplace rights, skills training, settlement, English conversation circles, how to get your credentials recognized if you're an internationally trained professional, and encouraging dialogue with political representatives, and so much incredible work. And this project actually wrapped up in March. So funding ended in March, right before COVID became, a pandemic and a global health crisis. When things are seemingly, I wouldn't say good, because they weren't ever good, but prior to the global health crisis, before that, there was already like inequality. And now in times of uncertainty, the existing inequality seems to be, as Salma has mentioned, factual, there's statistics, shows that things have been amplified. So now there's an increase need to address gender-based violence, improve access to economic security, and invest in essential services, because, you know, women, girls, and gender diverse people are going to be disproportionately, or are disproportionately impacted by the pandemic. So I'm happy to hear about all those updates, Salman. It seems like they're trying to sort of get ahead of the curve, but things have been happening systemically for such a long time that, you know, the pandemic really exacerbated a lot of the inequities. And so it seems like it's a little bit difficult to move forward, but I trust with all the incredible work and all the updates and the work from the grassroots levels and all levels of governments that we can work together to tackle, you know, economic justice for women. And then I've spoken to a lot of women during this pandemic, and women who are finding even more of a challenging time finding meaningful work, flexible work, you know, full-time work. And they're concerned about their work place safety. And you know, before COVID, our community action leaders thought about how we can achieve decent work. And we looked at some recommendations, and we came up with some of our own, you know, establishing paid sick leave for all workers, you know, more funding in childcare, you know, taking a more gendered approach to understanding things like homelessness and workplace discrimination, and as well as more funding for charities and nonprofits. And those were things that we needed before. And I feel like we're all in agreement that those are things that we need even more now. And, you know, I think approximately half of Canada's COVID-19 cases were acquired due to like community transmission. And I think there was like a number of reasons for this, but, you know, what was said was that one of the ways that they could have helped spread us or reduce the spread of the infectious disease was to establish like a paid sick leave for all workers. But workers are less likely to have sick leave and benefits if they're, you know, not working full-time and they have part-time work, which is likely the case for a lot of women. Part-time, very precarious, you know, temporary, low income. And it's really just unfortunate because a lot of things are intertwined. And you know, and then you have, you know, low income workers, mothers get paid 15% less than fathers. And then single mother having the lowest average adjusted income amongst women. So there's still a pay gap. Women are still likely to be employed part-time, which means they're less likely to have benefits or paid sick leave. And we should look at how to give women access to hot jobs and allow them to take on more leadership roles and create inclusive spaces. And those were on the to-do list before COVID, and I think they just need to be addressed even more now. Yeah, thank you.
Thank you, Soha, and really thanks for raising some important questions about the economic uncertainty of women. And I represent a very diverse riding, so I know that women have been hit hard. And then, if you see minority women, women of color, who were already not there at the level in order to compete with and have all those benefits and have some good jobs. So this pandemic has even hit them more.
Exactly.
So, as part of the work which I do on behalf of women and represent them at the Standing Committee for the Status of Women, I have always talked about giving a lens so that we make sure that we look into issues what the minority women or women of color or indigenous women or lesbian women face, so that we can take appropriate measures to provide support for all women coming from all diverse backgrounds. So I think this is, we need to add that lens in the decisions which we take related with the economic prosperity of women. So thank you, and we will continue our discussion. I will now invite Zainab Habib. She's the house manager at Nissa Homes. Nisa Homes is located in Scarborough, and they serve many women who are facing homelessness. So, Zainab, welcome, and thanks for agreeing to join us today as we talk about domestic violence and how domestic violence, what do you see during this pandemic? So, over to you, Zainab.
Thank you so much for having me here today, Minister Zahid. It's a pleasure, and I really appreciate this platform. Like Soha said, it's definitely a conversation that needs to happen. As women and women of color, especially, we see a lot of things, an increase in a lot of things since the pandemic has hit. Just to give you a bit of a background, I'm the manager for Scarborough Nisa Homes. We are a group of transitional homes. We have 6 homes across Canada. Scarborough is one of the newer ones, but we have a home in Edmonton, Calgary, BC, Windsor, Scarborough, like I mentioned. To date, we've helped over 617 women and children. We've helped them with shelter. We've remotely assisted over 2,000 women, and we've dealt with over 2,936 inquiries since Nisa Homes was established. So like you had said, we are a group of transitional homes. We assist refugee women, non-status women, or women who are at risk of homelessness or becoming homeless. We are a safe haven for these women. People, most of the women that do come to us are women escaping domestic violence or poverty, and we are essentially a center of empowerment for these women. We aim to give them hope, and we want to rebuild their lives and help them regain their dignity. So we provide a safe place for them to live comfortably. We provide a supportive home environment, and it's all essentially to help them connect with their community, because a lot of times the women that come to our homes are kept in isolation, and they're isolated from so many things, and that's where we step in to help them. Speaking on the pandemic, though, since the start of COVID, we have noticed an increase in the number of phone calls we get within the shelter, and it's doubled. We were receiving on average 200 phone calls a week prior to COVID, but since the pandemic hit, that number has doubled, and we see 400 phone calls, and these inquiries that we get on our phone calls range from everything to food insecurity, all the way down to the domestic violence, which is we have conversations where women are telling us that they have to escape because their abuser or the husband or their partner is telling them that you're going to bring home COVID, or you're going to give me the virus, and it's just an unsafe environment for them in their home. And I think Soha spoke to the job market since the pandemic hit. Because women have lost their jobs, a lot of the phone calls we get is food insecurity. They just can't afford to pay for their next meal or buy groceries, and that's it's a scary statistic, but it is what we see. I think Soha had mentioned that the employment for women had dropped amongst 5%, and it's especially in the age range that we see, which is women aged 25 to 54. And that's why we are getting the increase in calls. COVID has complicated a lot of things too, because one of the main features of being in this pandemic means that we have to do social distancing. So for women that are experiencing domestic violence, it's impossible to socially distance when you're living with your abuser, and that's what the problem is. Like, how you're being told to socially distance and isolate, and you have to isolate essentially with the person that you're in fear of, and that's what we see a lot of the time too, especially in the last 3 months, that just the pandemic alone has increased, you know, this uncertainty for women. Like they don't even have the chance to call us. And when they do, the window of opportunity for them to leave the situation is so small because they're isolating with the abusive partner. A lot of the time, you know, we see it's pretty scary. There was a statistic from a study done by CanadianWomen.org that said 1 in 10 women are concerned about the threat of violence during the pandemic, and that number it's pretty scary. 1 in 10. I mean, the reason that I think that we are seeing an increase is because of the fact that there's job losses. The pandemic has not only affected people's ability to provide for themselves, it's also affected mental health, right? And I think that that's extremely important. And one of the things that we do offer as a service when women come to Nisa Homes is they're able to speak to our mental health counselor, and that alleviates a lot of the things that they're struggling with. And you know, it's really important that they get that out. Mental health is really, really important, and we've seen that because of the pandemic, a lot of women are struggling with it. They have the addition of, you know, mental health stresses. They have the addition of finding it difficult because they're dealing with their children that are not going to school. So there's so much baggage that comes with it. And our aim at Nisa Homes is to you know, alleviate some of these stresses. So yeah, that's pretty much what we've been seeing through the pandemic. I will end it by saying that, you know, there is hope. Our organization, you know, I want people to know that we exist. You don't have to necessarily flee or come and live within our shelter. You can call us and we are able to assist you remotely. We can put you in touch with other resources and other organizations if we can't physically help you. But at the end of the day, the the fact is that I want people to realize that we are a source of hope. And if there's anything that they're struggling with, that they, you know, I encourage women to reach out and get in touch with us, and we can see how best we can help them.
Thank you, Zainab, and thank you for all the work which you are doing to make sure that support is there for those women who are fleeing domestic violence. And It's really heartbreaking to listen that the number of calls which you are getting has doubled from 200 to 400 during this pandemic. So this really shows very clearly that the pandemic has hit very hard the women in our community. So we have to make sure that we look into these things and see that what can we do to make sure that we avoid situations like that. So thank you for all the work which you do at Nisa Homes. I will now invite Rasha Mehyar. She is the settlement manager at Arab Community Center. One of the branches of Arab Community Center are located in Scarborough Center. And thank you, Rasha, for all the work which you do in this community. So if you can please provide us and talk about your work in regards to the childcare responsibilities during this pandemic. So over to you, Rasha.
Thank you, Salma. Thank you very much for inviting me. And I'm very glad that I'm representing ACCT with the rest of the invitees here on the panel. Well, we've since the COVID hit and since mid-March, actually, we've diverted all our work remotely. So we work mostly online. We respond to calls, all types of calls that come to the organization. Just to give a very, very brief description of what the Arab Community Center does, we basically are an NGO that provides settlement and social wraparound services to newcomers to Canada. Our main, of course, the majority of the community we serve is from the Arab region and the Middle East, but we basically serve anybody who comes in, newcomer to Canada, that needs any assistance with services, whether it's applying for anything from a work permit to a PR or a citizenship, We also have many workshops and sessions that help newcomers settle in Canada and in Toronto specifically. So it has also, we've seen that work has increased a lot, even though we're working remotely. Our calls have doubled, if not tripled, over the past few months. Many of what has already been discussed and the issues that have been discussed, we have also seen at the organization. I would focus actually also when it comes to the women's issues. A lot of what we are seeing now is women who have lost their jobs very early on at the beginning of the pandemic, especially that most of the community we help and assist work in the food industry, in supermarkets, in the retail sector. All those have lost their jobs suddenly. Some of them were able to get on CERB, others haven't. And with the phasing out of CERB and going back to work, many have not found any jobs to go back to work to. So this remains an issue, and it remains a big concern to the women who call us and to the women we try and provide services for. As a result of that, also, a lot of our women, being from newcomers to Canada, a lot of them from the region are from war-torn areas and zones, and therefore they are either single moms, widows, single heads of households with more than one child. Many of them have an average of 3 to 4 children. A lot of them have at least 1 or 2 of the kids will have would be autistic, have a disability, have special needs that need special care, that were suddenly stopped with the pandemic. So mothers found themselves without a job, in a home with more than 1 child, and unable to really get the necessary assistance when it came to childcare. Many of also the women we saw, they are under the poverty line. Many do not have the simple things at home, like Wi-Fi to assist their kids to log on to the Zoom when it comes to schools, or to access computers or laptops, or to attend school online. These things slowly came to get easier when the school system started providing laptops or tablets for the children to access. It was still a challenge, as many do not speak the language, or know how to, or have basically the IT sense and knowledge. So we try to assist people who call us. We try to assist with online workshops, some childcare, like with our youth program, helping with homework online to those who really could access online and wanted some help. We created a lot of workshops for youth online also to access. So in a way, we're trying to help and assist, but still, it's the depth and the magnum of the situation is very great. And right now, with what's happening is that a lot of our clients are also facing food scarcity, and therefore they're unable to provide healthy meals to their children. And we try to face this by joining up with local NGOs and some churches in providing fresh food baskets to clients. It remained for about over a month, but then the sustainability of it and continuity of it was difficult. And therefore, there's another issue we also face, is providing healthy meals and food to children. There has been definitely, as mentioned before, an increase of violence within the home, an increase of violence with kids, where child services have had to step in and had to solve the situation. Within our community, there's also a very, very big rise in divorce rates and women seeking divorce or asking for divorce. Again, as Zainab discussed, it has become a big issue, and we're seeing more of it now than we did before the pandemic. And basically, I mean, that's basically it. I mean, the last point I would like to mention is when returning back to work. This is also something that is of concern. That many women do not have jobs, and even those who do have jobs, employers are not always flexible, are not very clear on their policies of returning back to work. How do we return back to work, if it's full-time or flexible hours or not? A lot of, as I said, a lot of the industries, whether it's a food industry or retail, there's no really much flexible hours there. And if that's not helping with the lack of childcare or opening of daycares or opening full-time, returning to school full-time, it becomes even a bigger issue for the women.
Thank you, Rasha. And definitely, yes, that's a very big question we all have. I think we have heard from a lot of specialists, and they are saying very clearly that for the economy to recover, it is really very important that we have the she recovery. And for the she recovery, we have to make sure that we have appropriate daycare facilities, because we are right now not sure whether there will be full-time school coming in September or not. So if the women have to go back to work, we need to see that what will be done in regards to childcare, so that women who have young kids can go back to work. So thanks to Soha, Zainab, and Rasha for providing the updates. And you, all three of you, have raised some important concerns, and I think we really need to see what can be done and what all we can do together to make sure that women can go back to work, and women have been hit hard during this pandemic. We will go on to questions now. So I will request Zainab to maybe provide some answer to this question, if you have any suggestions, that how do we make sure that the women in our community feel safe in their homes and can open up if they are facing domestic violence at their home. So Zainab, if you can provide some update based on your experience and your work at Nisa Homes, what are you doing, and what suggestions you have in regards to this issue?
I always think that education is really important. I think a lot of the times, coming from culture, like a lot of the times it's a lot to do with culture. So women are, they're not forthcoming a lot of the times with what's happening behind closed doors. They might be suffering from abuse, and the culture stops them from speaking about it, because that's what they've been told, that you don't talk about what happens with your husband, you don't tell, you don't speak about it. So I think a good idea is, to go into have these open and frank discussions with our own family, because it starts with your family first, and have these discussions with the older men and with your sons, how we should be talking about women, and how we should, because a lot of the time what I do find is that the men will use the religion to justify what they are doing when it comes to domestic violence or when it comes to abuse. They use our faith, or they'll use Islam, or they'll use some kind of saying from the religion, and they will use that and tell the women that whatever the abuse is, you have to take it because we're allowed to do it. And that's why I say education is really important, and it's important to have these conversations with the community leaders, with people that like the mosque imams, with your husbands and with your sons, in addition to just having education as your back. It's also, I think, important to speak up, and tell these women, if we see something, or if you are, that there's a woman suffering from abuse, or there's a woman in a particularly precarious situation. I think it's important to let her know that there is people willing to listen to what you have to say, and encouraging her to speak about it, because suffering in silence is never a good thing. And there are so many supports available for women that suffer in silence. There are organizations, our organization, Nisahams, we do so much things for these women that aren't able to, like I was mentioning, they might not be able to come to the shelter, but we are able to assist them just by over the phone. Or if they can't get in touch with us through the phone, we have WhatsApp groups, or we can talk to them through any kind email or anything. But I always say, encourage these women that you speak to or that to speak up and say, look, I need help. And like I said, we're an organization that's out here to help these women. And of course, now, Canadian Women Foundation put out a hand signal to, if women that are suffering from abuse and it's difficult for them to speak on it, there's a hand signal or a hand gesture that they can do. It's basically like this. They just close their fist and you put your thumb, and that's something that's out there too. But a lot of the time, going back, it's just to speak up, seek that help. There are so many organizations out there to help women that are going through these situations.
Thank you, Zainab. We have one question from Stephen Cohen. Stephen is asking about what's government going to do to make sure that to support women and others to fight the systemic discrimination that is so prevalent in Canada. In the recent month, in the recent weeks, there has been a lot of discussion on systemic racism. And I know we have come a long way in Canada, but racism does exist. And specific for women, we took a bold step and we announced in June 2017 a gender-based violence strategy. And that strategy is based on 3 important pillars: prevention, support for survivors and their families, and promotion of responsive legal and justice system. So the gender-based violence strategy will fill gaps in support for diverse populations, which includes women and girls, Indigenous people, LGBTQ2 community members, gender non-binary individuals, those living in northern, rural, and remote communities, and also people with disabilities, newcomers, children and youth, and also seniors. So budget 2017 included over $100 million for 5 years for the gender-based violence strategy. And we will continue doing our work. And during this pandemic also, as I gave details on the fundings which we have announced during this pandemic, to make sure that help is there for the women who need help. So we have one more question, which is that how do we address mental health and anxiety issues women may face during this pandemic? So maybe I will ask Soha to add to this. Soha, if you can provide us that some details on what can we do to address the mental health and anxiety issues which women are facing during this pandemic. The responsibilities of the women have increased. They have the responsibilities of many are working from home. They are providing looking after the kids who are not going to school, making sure that they study. Even the other day I was talking to my nephew in Pakistan, and he mentioned, my mama has become a teacher now. She's more acting like a teacher rather than a mama.
Yes.
So the roles of women have increased. So increases anxiety level. And so if you have any suggestions to address anxiety issues women are facing.
For sure, and you're right. We've now had to become teachers, and the Google Classroom. It was hard to get a hold of everything, and for sure increased stress. I know at the Victoria Park Hub, we've switched over a lot of our programs because we still want to encourage self-care to virtual programs. So we have our yoga, our line dancing, our what we like to call our release classes, our relax classes, still online. And we did Zoom trainings for also a lot of our participants so they can get the hang of how Zoom works. And then we still invite, now that some of the restrictions have been lifted, in very small groups to the hub also to have, a talk with someone every now and then. And then I know there we have 7 different anchor partners at the hub, Family Services Toronto, which does provide counseling supports. They've gone also virtual. I think the number one thing to do would be to reach out to your local support centers, local organizations that are providing any type of counseling supports, and indulging in self-care in any way that you can find. And I think, like Zainab spoke a lot about, the cultural expectations, which is very hard because we had a lot of women come to, the hub and very scared to even speak, and in hiding almost. And just, I think we also have a responsibility working for these organizations to make sure that these spaces that we have are safe, and putting the word out there that they are safe spaces, not only for self-care, but just to talk to someone as well. And then creating, I know we have like a resource list as well of many different organizations that are still helping and open and willing to support. So yeah, for sure, self-care and just speaking and reaching out.
Thank you, Soha. We have next question from Ms. Bala, and she would like to know how can we support women who come from South Asian countries and who are facing cultural barriers. So if I can request Rasha, you do a lot of work with immigrant women at the Arab Community Center and women from different other communities. So what can we do to make sure that these women overcome the cultural barriers and be more successful here in Canada? Rasha.
Yeah, so basically we welcome all these women to the organization, whether it's we have many staff, counselors, women whom they can talk to. We also have all different types of workshops and sessions where whether it's carrying it on one-on-one or carrying it out in group sessions, where we introduce women to everything basically in Canada and help them settle in. So anything from how to ride the TTC to opening your own bank account, making new friends in the community, getting together, they get to make new friends in the community. We have several workshops for women only workshops, and also for senior women who come to Canada, where they can discuss with us issues they face, any discrimination issues they sometimes see on the street and don't know really how to deal with. We have several projects that are actually funded by government and by IRCC that help women with their English language. One of our projects is a food project where it assists women getting their food handler certificate and equips them to basically work in the job market, start their own catering business, start their own small business. So it's we take it baby steps with clients who come to us, and we don't really leave our clients. We see them keep on returning to us, wanting more help, wanting assistance, till they feel comfortable enough that they're there out on their own in the society.
Thank you, Rasha. And I think this topic which you have discussed about providing economic empowerment to the women through programs like food handler certificate, so that will allow women to do some maybe catering business even from home, and that can help them with the economic prosperity, adding to the income of the family. So during these uncertain times, so I think these are types of works which are really very important to help the woman get to work and have the economic prosperity. So I think some important questions have been raised today, and thank you to all 3 of you for joining today and contributing what you are doing and what you think needs to be done more to make sure that help is there for women who have been hit hard during this pandemic. So thank you once again to all of you. for joining us today and being there for the community here in Scarborough Center and Scarborough. I have seen the work of all of you. You are doing an amazing work to make sure that help is there for all women. Um, I just, before I end, I just want to say to everyone, all those who have joined us today, thanks for joining. Hope all of you are safe and enjoying the summer weather. It's a nice weather to go out to the park for a walk, to admire the nature. So please, whenever you go out, make sure that you follow the public health advice. Wear a mask. In the city of Toronto, it is essential that you all wear a mask if you are inside, whether you are at a grocery store or at any other facility. So please continue taking the advice of the public health. It is really very important. It is for the safety of everyone. It is for the safety of yourself. It is for the safety of your loved ones, safety of our parents and grandparents who have been hit very hard during this pandemic. We have seen that it has been very tough. So we have come a long way here in Canada and in Toronto. But I would say to all of you that we are not still out of the woods, and the pandemic is still there. So we have to take appropriate measures to make sure that we stop the spread of this COVID-19. So thanks for all your efforts, what you have done. The stage where we are today is through the efforts of each one of you for cooperating with the public health and making sure that you took all the measures. So I'm really very glad, and I'm very proud of the community I serve here. Because I have seen always, but especially during this pandemic, the way all of you have stepped up and you have been there for the vulnerable people. I have seen all the food banks in our riding got so many volunteers, so many people made donations to our food banks to make sure that food is there for all families, because food insecurity was one of the biggest issue which we had when the pandemic hit us, so, and continues to be, as so many Canadians lost their jobs. So I am very proud of each one of you who have stepped up for being there for each other. And I know as Team Canada, we will inshallah definitely get through this pandemic. Eid ul-Adha is also coming on July 31st, Friday, and it will be celebrated at Eid ul-Fitr. All the religious places were closed and people didn't get any opportunity to go and offer their prayers. But now mosques are operating at 30% of their capacity, and all the religious institutions are operating at 30% capacity. So the Eid prayers will happen. But my advice to all of you is please follow the advice of the public health. Wear your mask when you go inside the mosque for prayers, or you go for any religious service at a church or a gurdwara or a temple or a mandir. Please follow the advice of the public health. It is really very important that we cooperate with the management, because they have to do a lot more work to make sure that physical distancing is done at the religious institutions and everyone is kept safe. So please cooperate with the management of the religious organizations so that they can continue serving all of us. So thank you once again. Thank you to all our three special guests, Soha, Rasha, and Zainab. Keep up the good work. And inshallah, definitely we would see you sometime soon. Hope all things go well. So thank you and have a safe summer. Thank you.
Thank you so much, Salma, and thank you, Rasha and Zainab. It was really nice hearing your input, and I look forward to actually seeing you somewhere down the line in the field.
Okay,
Yes,
thank you.
Thank you very much.